Scoliosis is the abnormal curvature of the spine. It affects roughly 2 to 3% of the world's population. That includes our own meteorologist, Maureen McCann. She recently caught up with a local spine surgeon for a closer look at scoliosis and to stress the importance of early detection.
Well, now that school is back in session, it's a popular time for students to go through scoliosis screening, scoliosis being the abnormal curvature of the spine. And here to talk more about that is Dr. Jason Lowenstein of Spine Austin. And first I just want to say, and I was just talking to you about this, that this is of personal significance to me because I was diagnosed with scoliosis when I was 14. Wore a back brace for 4 years. I think we have some pictures of my before and after. This is before my spinal fusion. I was braced for 4 years. It didn't work, so I got fused, and that's what I look like now. 18-inch rods down my back. And we're here to talk more about scoliosis screenings. How common is scoliosis, Dr. Lowenstein?
So scoliosis affects probably roughly about 2 to 3% of the population in young adolescents. Most children are diagnosed with scoliosis around the ages between about 10 and 14, right before they hit that adolescent growth spurt.
So when should students go through their scoliosis screenings? Is there a certain age or grade, even here in Texas, that they're supposed to do it?
Here in Texas, children get screened in school in grades 6 and 9. So in 6th grade and 9th grade, they get checked by their school nurses or at their facilities in their school to make sure that they don't have asymmetry of their back or an obvious curvature of their back or an obvious spinal deformity. There's more sophisticated ways to screen using a scoliometer, which is basically a level to try to see if there's a rotational deformity in your back when you lean forward and have an Adams forward bending test. And if there's any sign of asymmetry or any concern by the screener, then they're sent to either their pediatrician or spine specialist like myself to get evaluated to see if they possibly have a spinal deformity.
And I always tell people that I didn't get a screening when I was young, and my mom noticed that. She's a nurse. She noticed that one of my shoulders was a little bit lower than the other, and sure enough, it was scoliosis.
So we were just talking about this. Mom always knows, and that's probably one of the best indicators for a possible spinal deformity is if mom thinks that something has changed. No one looks at their child more than mom, and mom seeing that there's a problem is usually indicative of that being the case.
And what specific methods of treatment do you guys do at Spine Austin for your scoliosis patients?
So we screen our patients. We have a large number of patients that are referred to us, either from local pediatricians or family practitioners, or even from parents or from schools to get evaluated for scoliosis. If there's a concern, we oftentimes get a 36-inch scoliosis x-ray, which is a full-length x-ray of the entire spine to try to see if there's any type of spinal deformity. If we do see there's a spinal deformity, there's a cascade of different treatment options. If it's a small spinal deformity, what we usually do is observe it. So we'll have the patient come back in 6 months or a year and get new x-rays and make sure that their curve isn't progressing. If there's an obvious large curve of a certain magnitude, we consider doing bracing right when we meet them. And the bracing consists of a sort of a clamshell brace that tries to push the spine straight and hold it in that position while the child reaches their skeletal maturity. And usually once they've reached full skeletal growth, the curve won't progress after that point. And there are some children that come in and have really severe scoliosis, and at that point sometimes surgery is the right option for them at that time.
Yeah, and I went through both the brace and the fusion. Well, Dr. Lowenstein, I'll be seeing you in San Antonio for the Scoliosis Research Society Global Convention right here in Texas. It's going to be taking place 24th through the 26th.
We're excited to see you there. It'll be great.
And for more information, you can log on to the National Scoliosis Foundation's website at scoliosis.org. You can also check out spineaustin.com.